We need to treat brain health early before we punish it later, and that's foundational in our efforts and our partnership with the legislature, which I'll brag on more in a moment. But I want to contextualize this a little bit because Judge Manley hit on something that hit a chord with me. We've been asking the wrong question. There's an old adage, if you don't like the answer, ask a better question. And for years and years and years, we've been asking the wrong questions. And it goes to the core of what the judge was offering. And that was his perspective on the front lines that we were trying to reform a broken system. And in the margin, we were reforming it. We made progress with Laura's Law, opt out, opt in. But when you looked at the results, 200, by the way, this is an exact number, 218 people in the entire state of California served by Laura's Law. That wasn't much of a reform. That certainly is not demonstrable progress. When you look at LPS, Lanterman-Petra Short Act, going back to my birth, mid-1960s, we're talking about a world that no longer exists. We're debating old debates, wounds on all sides of the aisle. People that want to reform in this direction, people feel it's over, we reform too much in the other direction. And so we decided to take a different tact, a different approach. And we started having conversations anew, started asking better questions, and that's where we landed on this new approach. Rather than reforming in the margins a system that is foundationally and fundamentally broken, we're taking a new approach. And we're offering a new strategy and new partnerships, but we're offering it in a way that we haven't in the past. And that's with resources. We have not taken our eye off the ball on the issue of homelessness and mental health in this state in the last 3 years. I know everybody thinks we've been zigging and zagging from crisis to crisis, and oftentimes that means we've lost sight of what's in front of us, the issue and the crisis of what's happening on the streets and sidewalks across the state. We haven't. When we got here 3 years ago, the state of California had no plan, no homeless plan, nothing. Didn't exist. There was no strategy, there was no plan. There was no accountability. There was a $500 million appropriation that went to the cities and counties, but that was it. That was 3 years ago. I want folks to know what exists today and what we're promoting into the future. We have approved $12 billion from $500 million and no plan, no accountability, to a $12 billion multi-year investment that has been approved by the legislature, where we are investing in proven evidence-based strategies with accountability plans required for the first time in history and oversight, with a resourceful mindset to build and rebuild and reimagine a future by developing partnerships that we could not develop in the past because we didn't have the resources to back them up. We have developed and organized and architected a system that has been backed up by unprecedented investments, including an additional $2 billion that's in front of the legislature for consideration. If they approve that package, $14 billion will back up this approach and this new strategy. And by the way, that includes $3 billion specifically to build housing and support clinical placements for people with severe mental illness. By the way, that's the biggest expansion in this space since we started dismantling the system infamously in that first Governor Reagan budget in 1967. We couldn't get to this point without having done that work in the last few years. Because every time you enter into this conversation, people are understandably concerned about all the support that is expected but doesn't exist, and then the demands we make on the cities and counties and care providers where they have no placements, they have no capacity to actually perform. We flipped that paradigm. We are now providing unprecedented supports. And by the way, just on the Prop 63 Mental Health Service Act, just a few years ago it was $2.1 billion. Ongoing money this year, $3.7 billion. 2.1 to 3.7 billion. We're not only putting the money, as I noted, in that $14 billion broad package, but we put, and you heard Dr. Galley reference IST, we put $650 million of additional money just in the IST program this year. That's in front of the legislature for consideration to start to address the gaps in that space. We put $4 billion approved, thank you, Senator, thank you, now Mayor, then former legislator, Gloria, advancing $4 billion to provide comprehensive services, screening, and support for all of our kids 0 to 26 in this state. That's the most significant mental health investment that we've ever made in the state's history. That's in addition to everything else we're talking about. That's just broadly to deal with all of the challenges and stress that our kids are suffering through, not least of which over the course of the last couple of years through this crisis. So I want to just emphasize this point, and I don't want to get too lost in the weeds. We've put out these details into the public, but I want folks to know we are taking a new strategy, taking accountability across the spectrum. And it's not just, as the doctor said, Gally, it's not just for individuals. It's also for the system. We got to deliver. You deserve it. What's happening in this state, as Mayor Schaaf said, is unacceptable. There's no compassion stepping over people in the streets and sidewalks. There's no compassion in reading about someone losing their life under 280 in an encampment. There's no compassion in that. I mean, we could hold hands, have a candlelight vigil, talk about the way the world should be, or we could take some damn responsibility to implement our ideals. And that's what we're doing differently here. And that's what we're advancing differently here today. In this care court, it's going to be stubborn. We got work to do. We got to get approved by the legislature. We want to move this in the next couple of months. But we have partners, not just Judge Manley, the courts themselves. The Judicial Council has been incredible, helping support and guide and advise. This framework in the disability community of not being substituted in the treatment, but being supportive is profoundly important. And that's why we have a lot of leaders in the disability rights community that says, all right, I'm open to what you're doing in a way in the past where I may not have been. And that's exciting. Care plans, support, community-based organizations supporting those care plans, counties supporting those efforts, real accountability. And as Todd said, in the back end, if that accountability doesn't go into effect, we have the ability to now move people on the back end with a presumption through the more traditional mechanisms to get people the help that they deserve. Those that, again, are on the psychiatric, are dealing with psychotic disorder or schizophrenia spectrum, folks that just simply can't help themselves.